I am Dr. Renato Cuocolo from the University of Naples Federico II, and I'm here to talk about an article published in the Journal of Magnetic Resonance Imaging titled Characterization of Adrenal Lesions on Unenhanced MRI using texture analysis, a machine learning approach. Adrenal lesions are frequently detected on imaging studies as incidental findings and are mainly represented by benign adenomas, which can be further divided into lipid-rich and lipid-poor. Differentiation between adenomas and nonadenoma adrenal lesions may be challenging, especially in the case of lipid-poor adenomas, which may be quite similar to nonadenomas based on imaging findings. Long-term follow-up, biopsy, or surgical resection may be the only ways to obtain a correct diagnosis. Texture analysis quantifies the distribution of intensity values in an image, essentially studying their degree of heterogeneity. The data that may be extracted can be categorized in different groups, ranging from geometric to first-order parameters, such as those derived from histogram analysis, and higher-order ones, like those derived from gray-level co-occurrence and run-length matrices. The difference between these orders of features is that, while first-order parameters only reflect the heterogeneity of intensity values without any information on their spatial distribution, this information is retained in second and higher-ordered ones. Machine learning is a branch of artificial intelligence dealing with the ability of computers to learn from datasets without an explicit programming. The learning process can be supervised when data instances are divided into classes that are known to the machine learning algorithm, or unsupervised when no prior classes are given, leaving the algorithm to autonomously classify the data. While it has numerous applications, it is mostly used in medical imaging to solve classification problems, as was the case for our study. The purpose of our study was to assess the diagnostic effectiveness of texture-derived parameters using a machine learning approach to characterize adrenal lipid-rich adenomas, lipid-poor adenomas, and nonadenoma lesions on unenhanced T1-weighted in-phase, T1-weighted out-of-phase, and T2-weighted MR images. For our patient population, we retrospectively evaluated all patients with adrenal lesions who underwent MR exams at our institution between September 2014 and September 2016. We then excluded patients with incomplete exams or exams affected by artifacts, and we also excluded suspected lipid-rich or lipid-poor adenomas without confirmation with long-term follow-up or histopathological diagnosis. Similarly, we also excluded suspected nonadenoma lesions without histopathological confirmation. Considering the least frequent lesion type, which were nonadenoma lesions with 20 cases, we decided to obtain an equal numerosity for our groups and selected the first 20 eligible consecutive patients for each category. In the end, 60 patients were included in our study, 20 with lipid-rich adenomas, 20 with lipid-poor adenomas, and 20 with nonadenoma lesions. The first step in our image analysis pipeline consisted in the manual segmentation of all lesions on all available MR images, so T1 in-phase, post-phase, and T2-weighted images. A spherical region of interest was placed at the center of each lesion, and its size was adjusted to that of the lesion itself. Subsequently, exams and the regions of interest were imported in a second software 3D slicer that was used for texture analysis data extraction. In all, 138 features, including those derived from histogram analysis and gray-level co-occurrence and run-length matrices, were obtained. The dataset that was then created was further analyzed on a freely available data mining software called Weka. We used this software to test different feature selection methods, in particular the subset evaluator, which looks for the feature subset with the highest correlation to the class, while keeping the intercorrelation between the single features as low as possible, the information gain ranking method, and the embedded or learner-based method, which tests the features by evaluating their performance with a selected algorithm, in our case the J48-3. The feature subsets that were thus generated were then evaluated by assessing the performance of the J48 classifier with each of them, and to test the clinical applicability and validity of our findings, the performance of the J48 classifier was compared to that of an expert radiologist who independently evaluated all cases blinded to their nature. The result was that the embedded feature selection method obtained the subset with the best performance on the J48 classifier. The selected features were the short-run high-grade level emphasis from in-phase images, mean intensity and maximum diameter obtained from opposed phase images, and standard deviation obtained from T2-weighted images. In this slide, you can see the whole decision tree algorithm generated by the J48 classifier using the feature subset derived from the embedded feature selection method. In this table, we can see that the J48 algorithm obtained an overall accuracy of 80% in classifying adrenal lesions on unenhanced MRI images, compared to 73% obtained by the radiologist. This difference was not statistically significant, and the performance of the J48 classifier can be considered not inferior to that of the expert radiologist. Of particular interest, it could be to note that the performance of the classifier in evaluating non-adrenal lesions was much higher than that of the radiologist. The sensitivity and specificity of the classifier were 89 and 82%, while those of the radiologists were respectively 63 and 68%. Our post-processing software pipeline showed promising results on unenhanced MRI images in the characterization of adrenal lesions, especially nonadenomas. This in turn may help clinicians and radiologists to better direct patients in the management of these lesions towards a more conservative approach with clinical, laboratoristic, and imaging follow-up, or an interventional one with biopsy and/or surgery for lesions more suspect of not being lipid-rich or lipid-poor adenomas. I invite you to read the full paper on the Journal of Magnetic Resonance Imaging for further details. Thank you for your attention.